Okay, so I carried out a 4-week studentship, during which time I undertook two projects. So one of them was on performance gap, and that was in CSEC, and the other one was on SBAR. SBAR is a clinical communication tool, and that was with Dr. Ian Walsh. So what is performance gap? Performance gap is the difference between expected and observed performance. And in medicine, we were looking at OSCE performance. So why some students who went into their OSCE knowing everything about a particular clinical skill didn't perform it as well as they were expected to. So for the first week, I undertook a literature search. So I'd never done that before. It was a really good experience doing that, and I found a few papers in nursing and pediatrics which showed performance gap and showed that it existed. Um, so then I went on and I had another wee look at those papers, but I noticed they didn't actually show why the performance gap was caused. They just showed, resolution of it. So I wanted to have a look in and see what actually caused performance gap, especially with medical. Um, so I researched non-cognitive factors for poor clinical performance, and I found anxiety to be a major factor. Anxiety can cause distraction within the OSCE, and it's heightened compared to other examinations because of the real world situation scenario of the OSCE. I also found that situational pressure, as it was called, can add to OSCE pressure. So this is things like the patient having a non-cooperative patient or a patient who appears angry towards the student can really put them off and increase the pressure. So I devised a protocol. So that was a questionnaire with subsequent focus groups, and because of the time frame, with it being in the summer, we couldn't get students in to complete it, but it was a really good experience doing the protocol. I learned how to plan, execute, and analyze a study protocol, which is, it's a really important clinical skill, um, especially if I wanted to get into further research, and it's skills that I'll use in the future. So what did I take out of this? Well, I thought it was, just great to get that experience of writing up a paper and writing up a study protocol, but I really thought seeing under the hood of CSEC and seeing how everything works was a really good experience for a medical student. So yeah, it was a great project, and there's a lot of opportunity for me to progress the research. We have talked about maybe in September and October, me coming in and carrying out the questionnaire focus groups, which I think would be a great experience, should it happen. So my second project was short but sweet. It was over the course of about a week and a half, 2 weeks, and it was working on an ethics approval for a paper on SBAR, and that was with Ian Walsh. So ethics was something I've never done before, so I found it really, really interesting actually. So what is SBAR? SBAR stands for Situation, Background, Abstract, and Recommendation. So who uses SBAR? Well, doctors are supposed to use it in the hospital. It's recommended by the NHS in handovers, so that the patient is handed over safely. So why are we looking at uptake and usage? So that's what we were trying to see. So apparently with SBAR, there's a bit of a culture in the hospitals that it's not really needed. Some of the older doctors maybe think that it could be shortcutted and bypassed. And study population we're looking at were medical students. So reasons it's not used, basically because it is a bit of a long-winded process, and some of the older generation are not used to using it. Medical students as well, going into the hospitals who have just learnt it, may not feel confident enough to speak up to their older peers, so it just kind of gets lost. So Ian Walsh carried out a pilot study last year, and the results found that S4 wasn't used effectively within the hospitals. However, the medical students who took part in the study didn't want a different clinical communication tool. So what this means is that we need to improve uptake and usage of the S4 tool. So the new study will be looking at both final year students and F0 doctors to see if the F0 doctors can step up a bit to their peers and try and offer, improvement. So my role in all of this was to try and get ethical approval for the paper. So what I had to do was go through and edit the protocol, questionnaire, focus group questions, pretty much everything that had been in the pilot study, and then apply for the ethical approval via an ethics checklist. So how could I use this in the future? Well, I think there's an immediate, obvious usage to me, and that is if I go forward with the performance gap paper, I'm obviously going to need to apply for ethical approval, so I'll be able to do that by myself, which is, it's just great. It means I don't have to get anyone else in to do it. So some additional benefits for me, Ian Walsh recommended that I get up at the ASME conference or maybe even InMed and present his findings next year, which is, amazing. It's extraordinary that I would get that opportunity so early in my career. And then just an overall conclusion, I thought the studentship was absolutely great. I really enjoyed my time, and I think it's all experience that'll be relevant for me in the future. I'm sorry that I couldn't be there today. Judging by the date, I'll probably be somewhere similar to the picture behind you. Thank you very much.